CataractCoach.com, 3 golden rules for patient discussions. It took 10 years to learn these 3 important rules. Today I want to talk about 3 golden rules for patient discussions. It's July 2021. We have our new residents who are in clinic and they're learning a lot. And they want to know, well, what's the best way for me to communicate with patients? I said, it's really important. Physicians have to understand the importance of patient discussions regarding surgery. Letting patients speak, making a specific recommendation, explaining what to expect. Those are all important parts of the surgical process. I was very fortunate to have exemplary mentors during my residency training 20 years ago, more than 20 years ago, who taught me everything from the science of ophthalmology to surgical techniques. And among the most important lessons was learning how to prepare patients for surgical procedures, to discuss the issues and answer questions appropriately. There were 2 mentors who were amazing. Bob Goldberg, an oculoplastic surgeon, and I don't do oculoplastics, but I learned so much from him. And Brad Stratsma, the founder of the Jules Stein Eye Institute and first chairman of ophthalmology at UCLA. He's a specialist in ocular oncology, but both of them have a superb, almost natural gift or talent in connecting with patients on a deeper level, almost effortless. So these are some of the pearls I'm going to share with you tonight, 3 pearls that I gleaned from working with them more than 20 years ago at the Jules Stein Eye Institute, UCLA. I'm always honored to be a graduate of that program. It has served me well throughout my life. So number 1, connect with patients and let them speak. So the first rule for these patient discussions is to let the patient speak. As simple as it sounds, patients are often unable to complete their thoughts and sentences because a hurried physician cuts them off abruptly. Our patients trust us with their most precious sense. It's their sight, come on. And we need to understand their concerns, questions, and issues before proceeding with surgery. Be seated next to the patient, put down the pen, put away the keyboard, and listen to their thoughts and their apprehensions. Address each of their concerns, being careful to paint an accurate picture of the potential risks versus benefits of your proposed procedure. Remember, you want to under-promise and then over-deliver. Take the time to see the situation from the patient's perspective. They're worried about their ocular condition. They're about to undergo a surgical procedure. They don't even know what to expect. When patients ask many questions after doing research on the internet, understand that they're well-read and sophisticated patients with a desire to know more. Help them sort out the information and make an informed decision. Be formal and polite, not casual and abrupt in your discussion with these patients. Bring in family members into the room, and that can often help put the patient at ease and help in decision-making. So that's rule 1. Rule 2, make a specific recommendation based on your expertise. That's why they're seeing you, right? So give a specific recommendation to the patient and don't give a list of options. Patients are seeing you for your expertise in ophthalmology, and they want you to guide them toward what's best. If you give a list of potential options, how does the patient figure out which one's best? Let me put this another way. You are an ophthalmologist. You're smart. You're a physician, a surgeon. You graduated from med school, top of your class with honors. You scored 99th percentile on the boards, even though they don't score on the boards anymore. But you need a hip replacement surgery. You are the patient now. And I ask you, which of the many different hip implants do you want? Do you want this titanium one, this fenestrated one, this Teflon coat? What do you know about orthopedic surgery? You're an ophthalmologist, right? So you're going to have a hard time deciding. So now look at our patients who just want the best possible vision for their daily needs given their anatomy. How are they to know which lens implant is going to work best for their anatomy or their measurements or their biometry? They don't know. Your patients don't truly understand astigmatism like you do, and they will not know if a toric lens is right. But you know. So you tell them how you would want to have the surgery if it was your cataract surgery being planned and you had their measurements and their biometry and you had their expectations. Dial it in. And when the consultation is complete, realize that patients are going to go home and spend hours thinking about your visit and their upcoming surgery. They'll think of more questions. They want to ask you more questions. They may need a follow-up phone call or maybe an email conversation so you can finalize some of the details. The key to remember is give the patients the same high level of care that you would want for your own eyes. And the last, number 3, our third point is explain the surgical procedure and what to expect. So our commonly performed surgeries like cataract surgery, they're routine to us. But remember, for each patient, every surgery is critical and of the utmost importance. You'll do tens of thousands of cataracts in your career. Each patient will have only 1-2 cataract surgeries. That's it. But that's all that matters to them. Focus on explaining the patient experience more so than the specific technical details of surgery. Patients want to know that you're targeting their vision for distance, but they're not as concerned with your choice of IOL calculation formulae. Similarly, patients want to know if the surgery is going to hurt, but they don't understand the nuances of a single plane versus a multi-plane corneal incision. Don't worry about that with them. You do what's best for them, but explain them what's important in their perspective. When using a new device or instrument in surgery, understand there's going to be some learning curve. While we can gain experience in the wet lab using a model or porcine eyes, we continue to hone our skills with the new equipment for hundreds or even thousands of cases. For my cataract surgeries, I like the incisions that I make in surgery to barely nick the limbal vessels. That ensures great long-term wound stability and healing. When I began to use a femtosecond laser for cataract surgery more than 10 years ago, I had to carefully program the laser to achieve that same effect. But with guidance and practice, this became routine. If you're performing an unusual procedure, such as an iridoplasty, your total experience may only be a handful of cases. Explaining the additional risks of this procedure to the patient is important in making an informed decision. In these cases, patients will understand that they have an unusual condition, and they'll be more conservative in their expectations. You know, one of the most enjoyable aspects of being an ophthalmologist is interacting with patients, particularly before and after surgery. I mean, post-op day 1 is the most fun. Every patient's so happy and says, "Thank you, I can't believe I can see this well." So remember, take the time, talk with patients, establish deeper connections, explain the details of the surgical procedures. All that's going to lead to happier patients and a more rewarding experience for you, the surgeon. It also explains why my mentors, Dr. Goldberg, Dr. Stratzmer, were always happy to see patients and always greeted them with a smile. So I think you could do the same thing, learn a lot from this video, and thanks for your attention. Thanks for watching these videos, and remember to go to CataractCoach.com and sign up for a free daily email. We'll send you an email every day with a great video like this and other surgical pearls that'll make you a better surgeon.